Is Professor Jonathan Javitt to talk about the medicines from Neurorx Pharmaceuticals, a company that is now trading on the NASDAQ and is offering new insights and opportunities to treat critically ill COVID patients. Professor Jonathan Javitt joins us now. Thank you so much for being with me. Tell me more, Professor, about the drugs that you have and what Neurorx is doing to help COVID patients.
Well, the first drug we're developing is a drug called Zysami. It's made from a natural substance that's always made in the body called vasoactive intestinal peptide. And that's the substance that nature designed to protect the lung from all sorts of injuries, including, of course, coronavirus. The way Zysami works is it binds to the cell in the lung that's attacked by the coronavirus and protects that cell against the effects of the virus. That's what we know from laboratory evidence. And now we've seen in our first clinical trial that Zysami's been associated with a statistically significant increase in both survival and recovery from respiratory failure in patients with COVID. So we're hoping very soon to apply for emergency use authorization from the US FDA.
There are other drugs, Professor, that treat respiratory failure and illness related to COVID. What sets your drug apart?
Well, I'd like to agree with you, but in fact, the drugs that exist for COVID right now are designed to treat the inflammation that's caused by the virus. You have all the drugs that sort of end with a MAB after their name, that are monoclonal antibodies that attack inflammation. You've got remdesivir that attacks the virus itself. But in terms of drugs that are currently approved for treating respiratory failure and helping to get the patient off the ventilator and out of the ICU, there's not yet a drug that has shown either increased survival or increased recovery from respiratory failure in those desperately ill patients.
So you now are being traded publicly, you're on the NASDAQ. Do you have an emergency use authorization for the FDA? Do you have regular use? Tell me more about the process.
You've beaten us just by a few hours. So we're merging with what's called a SPAC, a special purpose acquisition company called Big Rock Partners. They currently trade as BRPA. And by the end of the day, assuming their shareholders vote for this merger, we hope that that company will be renamed Neurorx Pharmaceuticals, trade as NRXP, and that will be us.
And the drug has emergency use, or there's still more permits or approval processes moving forward?
So at this point, the FDA has approved it for what's called expanded access, which still comes under the phase 3 programs of the FDA. We finished the first randomized clinical trial. We're about to submit that data to the FDA. The NIH has started a global second clinical trial. Dr. Fauci talked about it from the White House just a few weeks ago. And this month, by the end of this month, we expect to submit to FDA asking for emergency use authorization.
Professor, thank you so much for being with us, and good luck with you and the company on the process. And congratulations on the success so far.
Thank you.